that LGBTQ plus individuals have more of a hesitancy going to seek medical care. And there's a number of reasons for this. One of the main reasons is that LGBTQ individuals have often faced discrimination in their lives in terms of getting health care. We're one of the few minorities that actually can be discriminated against at home. And therefore, in smaller communities, a lot of LGBTQ individuals who may not be out will be hesitant to go to see their doctors or talk to their families about health issues that may come up, especially if it's related to sexual health. So a lot of concern that we have and a lot of the potential for telehealth for LGBTQ plus individuals is helping individuals in smaller rural communities that may have one doctor that goes to your church, that treats your parents, your cousins, and that you may not feel comfortable talking to if you're not out, or even if you're out, you may not feel comfortable talking to about sexual health. So telehealth can help rural individuals to reach out to communities and to doctors that can be much more understanding of their needs. Another way to do this is LGBTQ plus individuals are known to delay going to the doctor because they're afraid of being discriminated against or for fear of not being treated equitably. So telehealth and digital technologies like this allow individuals to find affirming doctors and affirming care. This is especially true for transgender individuals. And for them, it's really important because the expertise that they need may not be in their community and may frankly not be anywhere for hundreds of miles around them. So the ability to do telehealth gives them a chance to work with individuals that are going to not discriminate and know their issues as well. Another big area where LGBT people suffer in a big way is kind of in the kind of peer-to-peer counseling and mental health services. There's a lot of stigma, obviously, with being LGBTQ, especially in smaller communities, in religious communities, in communities of color, and peer health and the ability to use telehealth to talk to counselors or to therapists or to other individuals that are going through the same experience as you are is one of the key uses of telehealth for individuals. And lastly, and as important is, as the LGBTQ population gets younger, they are used to using their phones for all of this. The Trevor Project has launched a text system, and the Trevor Project is a national LGBTQ suicide hotline. And now they have text services, and we have to keep up with the technology if we're going to reach individuals that work with us. But having all of this also brings a lot of dangers for our community as well, in terms of being outed, in terms of having their health data exposed, in terms of facing discrimination based on their sexual orientation or health status. And we've seen this in the past with HIV laws. We have seen some of this with contact tracing laws, where neutral laws can be applied in a non-neutral way to discriminate against marginalized communities. And so these are some of the ways. And so the data protection of health data, which is crucial to everyone, can be especially crucial for marginalized communities where the data can be misused or it can be leaked in a way that not only reveals your health status, but may inadvertently reveal your sexual orientation or gender identity and place you in danger. So there's a lot that we can get into on this, but that's kind of like the main thrust of where I'm coming